Welcome to this short video on stretching and range of motion for a person with a spinal cord injury. Maintaining proper range of motion through stretching is important because it helps a person lengthen tight muscles and helps to maintain proper posture and positioning in a wheelchair. Improper positioning can cause pressure points, which could lead to the breakdown of skin and skin sores. Proper stretching can help in improving a person's functional skills so they can get through the day better. Let's get started. Caution. These stretches must be done with the help of a caregiver. A person with quadriplegia should not attempt these stretches alone. Caution. Always consult with your medical provider before beginning any of these stretches. If the person develops symptoms of autonomic dysreflexia or pain, lessen the degree of the stretch or stop altogether. If the person is in a power wheelchair, start by tilting the chair back slightly. This puts the body in a better position for stretching the lower extremities. Also, work on one side of the body first for all stretches, then move to the other side. The first stretch is into hip flexion. Grasp one hand at the heel of the foot. Your other hand will rest underneath the knee and hold the leg up so it bends at the knee. Now, slowly drive the knee in and up toward the chest. Stop when you feel resistance on the leg or if there is an indication of pain. Hold for about a minute, then relax. Next is hip external and internal rotation. Move one hand under the heel and the other hand on the top of the knee. Rotate the hip externally by turning the foot towards the opposite knee. Move the foot in until you feel resistance. Do not push the foot past the point of resistance. Hold for about a minute. For internal rotation, switch one hand over the top of the heel. Your other hand will move under the knee. Now, rotate the hip in by moving the foot slowly to the outside until you feel resistance. Be sure to stabilize the knee with your other hand. Hold for about a minute. Now it's time to stretch the hamstrings. Caution. A hamstring stretch could set off autonomic dysreflexia. If the person starts to show symptoms of AD, do not continue with this stretch. Grasp the back of the foot with one hand. Hold the top of the knee with the other hand. Gently straighten the leg. Now move the leg up until you feel resistance at the back of the thigh. Hold for about a minute. Next, there are two stretches for the calf muscles. Start with the leg in a 90-degree position. Place one hand at the ball of the foot. The other hand is placed under the calf of the leg. Push through the ball of the foot to apply pressure to the calf muscle. Stabilize the leg with your other hand. Hold for about a minute. Now, straighten the leg. Support the leg under the calf muscle and push through the ball of the foot to stretch. Hold for about a minute. Now move to the other leg and repeat all of these stretches. Now it's time to stretch the upper extremities. Note, the amount of range of motion can vary greatly depending on the level of injury and mobility from person to person. For people with a higher level of injury, C1 through C4, do not raise the arm above 90 degrees for a risk of damaging the shoulder joint. Again, you will complete all stretches on one side of the body and then repeat all stretches on the other side. Start with shoulder flexion. Hold the arm out straight and place one hand on the wrist of the person, turning the person's hand so their thumb is pointing to the ceiling. Use the other hand and place it under the shoulder blade. Gently raise the arm up, while at the same time glide the shoulder blade up with your other hand. Hold for about a minute. Variation. Next is a scaption shoulder stretch. This is a variation on the shoulder flexion stretch, which can be a safer and/or more comfortable stretch. Hold the arm out straight, again, placing one hand on the wrist of the person, turning the person's hand so that their thumb is pointing to the ceiling. Support under the shoulder blade with the other hand. Now move the arm out between 30 to 45 degrees from the body. Raise the arm up, while at the same time gliding the shoulder blade up with your other hand until you feel resistance. Hold for about a minute. Next is the external rotation shoulder stretch. Caution: monitor the person's pain level and tightness in this stretch. Start by holding the arm up so the elbow is level with the shoulder. Bend the elbow 90 degrees. Place one hand just above the person's elbow. Your other hand will be placed under the person's wrist. Slowly move the wrist up vertically while supporting the arm at the elbow. Hold for about a minute. Now, gently rotate the arm down, stabilizing the arm at the elbow. Stop when you feel resistance. Caution: be aware that these stretches may cause the person to feel pain or discomfort. If this happens, stop the stretch immediately. Variation: internal and external shoulder rotation. If the person feels pain during the shoulder rotation stretches, there are variations to minimize pain. Place one hand just above the person's elbow and the other hand on the person's wrist. Tuck the elbow in next to the person's body. With the arm bent at 90 degrees, gently move the forearm out while holding the elbow into the body. For the internal shoulder rotation variation, rotate the forearm across the body while holding the elbow in. Hold each of these for about a minute. The next stretches are the elbow flexion and extension. For elbow flexion, start by holding the person's arm out and gently turn their arm so their palm is facing the ceiling. Stabilize the arm by placing your other hand under the person's elbow. Now, gently bend the arm up at the elbow until you feel resistance. Hold this for between 15 to 30 seconds. For elbow extension, support the arm at the elbow and slowly move the forearm out so the arm is straight. Hold for about 15 to 30 seconds or longer if you are feeling any tightness. Now, for the wrist flexion and extension, there are two variations to these stretches as well. Caution: for a person who has a C5 or C6 spinal cord injury and who uses tenodesis, use this variation. This variation is to ensure that they do not overstretch the tendons in their wrist and lose functionality. Stretch out the wrist into a flexion position at an angle, and then gently stretch the fingers out straight. Hold this for about a minute. For a person who does not use tenodesis, use this variation. Turn the wrist so that it is pointing up toward the ceiling. Use one hand to hold the palm of the person's hand to stabilize it. Gently stretch the fingers out straight until you feel resistance. Hold this for about a minute. Do not overstretch the fingers. Now move to the other leg and repeat all of these stretches.